In this visit, we'll go over how a woman can determine her 10-year risk of having a stroke. Aspirin reduces a woman's risk of stroke, but it does not reduce a woman's risk of heart attack. So it's her stroke risk which determines whether or not she should take aspirin for prevention, and therefore women should determine their stroke risk. When you've determined your stroke risk, you can then determine whether the benefit of aspirin in stroke reduction is worth the risk of increased side effects from the aspirin. On average, aspirin reduces a woman's risk of stroke by about 17%. On my YouTube channel, Tom Wade MD, there's a visit on how to decide if aspirin for prevention might reduce your risk of stroke once you've calculated your risk of stroke. So we'll calculate your risk on this visit. It is critical to realize that even people at low risk can have a stroke. Therefore, everyone needs to know the symptoms of stroke and TIA and what to do if they have symptoms that could be a stroke or TIA. To learn about stroke symptoms and what actions to take, see the visit Stroke Symptoms and Stroke Prevention on my YouTube channel. There are things you can do right now to reduce your risk of stroke. If you smoke, stop. It's critical. Next, lower your blood pressure with healthy living habits and medicine if necessary. And finally, take cholesterol-lowering medicine if your cholesterol is high. The risk factors for stroke include age, systolic blood pressure. This is the higher of the two blood pressure numbers. Taking blood pressure medicines is a risk factor for stroke. It's not taking the medicine that puts you at risk, but the fact that you need to take medicine to lower your blood pressure. In fact, getting your blood pressure down is the single most important thing you can do after stopping smoking to get your stroke risk lower. Diabetes is a risk factor for stroke, and therefore weight loss, if you are overweight, can help you lower your stroke risk because weight loss lowers your risk of getting diabetes and improves your diabetes control if you have diabetes. Again, cigarette smoking is a risk factor, and stopping smoking lowers your risk of having a stroke. Your stroke risk goes up if you have cardiovascular disease, and you're considered to have cardiovascular disease if you have had a heart attack, if you have angina chest pain, if you've been diagnosed with coronary insufficiency, if you have intermittent claudication. This is aching in the calf, thigh, or buttock while walking. And if you have congestive heart failure, then you have cardiovascular disease. A history of atrial fibrillation means a certain kind of irregular heart rhythm. And the final stroke risk factor is left ventricular hypertrophy detected on an electrocardiogram, a heart tracing. Left ventricular hypertrophy, also called LVH for short, means that the walls of the heart are thicker than normal. To calculate your stroke risk, get a blank piece of paper and a pencil. You'll need a blood pressure measurement, but the other risk factors we'll work through when we get to them. Write down numbers 1 through 8 down the left side of your paper. You'll write down your answer next to the number for that question. Then we'll write down next to each answer the points that apply to your answer. And finally, we'll go to the stroke risk chart to determine your stroke risk. Next to number 1 on your paper, write down your age. After you've done that, we'll look at the point value chart to see how many points you get for your age. So, write down next to question 1's age answer the number of points that go with your age. Now, for question 2, write down your systolic blood pressure, the higher of the two numbers. And then for question 3, write down yes or no to the question, are you taking blood pressure medicine? If the answer to question 3 is no, you're not taking any blood pressure medicines, you'll use this chart right here. This chart The chart for question 2 is the one you'll use to put down points next to your answer for question 2. And don't write down any points for question 3. If you answered yes to question 3, don't give yourself any points for question 2 and go ahead and go to question 3's chart. So, if you're taking blood pressure medicine, you put down the points for your blood pressure down next to question 3 using the values from the chart for question 3. You should leave question 2 blank in that case. Now question 4. Do you have diabetes? If no, write down 0. If yes, write down 3 for 3 points. For question 5, write down 3 if you smoke, 0 if you don't. If you've been diagnosed with cardiovascular disease, write down 2 points next to question 6. If you haven't been, write down 0. And remember, the answer is yes if you've had a heart attack, angina, coronary insufficiency, intermittent claudication, or if you've been diagnosed with congestive heart failure. If you've been diagnosed with atrial fibrillation, you should write down 6 points. If not, write down 0. Atrial fibrillation is a type of irregular heartbeat that is known to increase your risk of stroke, and specific medicines can reduce that risk. If you have left ventricular hypertrophy, LVH, thickening of the walls of the heart, put down 3 points next to question 8. If the answer is no, put down 0. LVH is diagnosed with a heart tracing, an electrocardiogram. If you've had one, you can ask your doctor if it showed left ventricular hypertrophy. If you haven't had an EKG, you could put down 0 for question 8 and ask your doctor if you need an EKG to help you determine your stroke risk. Now, add up all your points, and remember, you'll use the points from blood pressure chart number 2 if you're not taking any blood pressure medicine. You'll use the points corresponding to your blood pressure in chart 3 if you are taking any blood pressure medicine. So now add up all your points, 7-point values, not 8. If you need to, you can pause the video while you recheck your numbers. Now, here are the 10-year stroke probability charts. Use these charts, charts 1, if your total points are 14 or less. If your total points are more than 14, go to the next chart. Here are the charts 2 for point totals between 15 and 27. See the National Institute of Neurologic Disorders and Stroke Brain Basics to print out the charts, as well as to find more information on stroke risk factors and stroke symptoms. That's it for this visit. I hope you found it useful.